Welcome, Doctor. I'm medical doctor and psychiatrist, Dr. Husayn Aly. Is that right?
Yes.
And Ben Chinwah, good friend of mine. Introduce myself to Doctor. So we've been trying to work out to create this conversation for a while now. So thank you.
Pleasure.
I know you're a busy man.
It's a pleasure to be here.
Yeah.
Thanks for having me.
Yeah, nice.
Thank you, Danny.
Yes, you're welcome. So yeah, look, I was always hoping to get someone on like yourself to discuss, obviously the plan. Mental health is a big thing these days. Well, it always has been, but it's sort of a little bit more now, I find. In the labour force, trying to find workers, I find it's another challenge that's come on. The mindset of the new generation coming through, even people sort of realising that they have an issue, I don't know, a mental issue, I guess, from previous trauma. So that's what I like to discuss. So how did you start? What made you get into this field?
Look, after I finished my medical degree, I basically decided to pursue a career in medicine, or physician training. And after sort of doing that for a couple of years, sort of had felt that I needed to take a break from medicine. So I went out, pursued a few other things, which involved sort of further studies, started my own business, pursued, some volunteer work, held some board positions for volunteer organisations. And then basically when I came back to medicine, I felt a strong calling for one of two sort of specialties. The first one was psychiatry, which I ended up going into. The other one was obstetrics, which is delivering babies, and realised that I wanted to have a family of my own one day. So I opted not to pursue obstetrics because it has sort of quite a large impingement on your family life. And in hindsight, look, I'm glad I didn't because I think I'm very well suited towards a career in psychiatry, and absolutely love dealing with my patients and helping my patients to get better.
Oh, good. And where do you come into it, Ben?
Well, I guess being first and foremost, a husband, a father, but also a business owner in that as well. I guess our exposure to sort of mental health and that sort of arena is probably in the workplace now too. Our roles to make sure that people go home safely from the workplace and protect sort of business owners from going to jail under these work health and safety laws. So I guess more than ever now, off the back of COVID, there's a lot of emphasis now on risk management in the workplace around mental health and identifying certain workplace health and safety issues that affect, workers, right? From a psychological perspective, right?
Yeah.
And managing that risk. It's tough for employers now out there, right?
It is, yeah. And this is why I wanted to have you guys together, to discuss this, because I do labour hire. And I know there is actually a new law that could come in with psychological injury. You guys heard about that? And you do work health and safety procedures for work. So that would come into it.
Yeah.
And that's where you also come into it as well. How can you claim something like that for the workforce, for bullying, racism, all that sort of stuff. There's that topic as well. So how do you treat, who would come to you, the ages, what's the common age?
So I see patients generally 17 plus.
Yeah.
I try and restrict sort of my practice to 17 plus and try and minimise the amount of people over 65. So typically patients sort of in that bracket there. I do see sort of predominantly my two areas of focus is treatment-resistant depression and ADHD is sort of where I focus sort of the bulk of my work. And I'm also very interested in neurostimulation, so ECT, which is electroconvulsive therapy, TMS or transmagnetic cranial stimulation, And moving forward, things like psychedelics, ketamine therapy, these are kind of the areas that, like, I think I'll be moving more into as time progresses. But looks at the moment, certainly depression or treatment-resistant depression and ADHD is sort of the bulk of my work at the moment. In addition to a lot of workers' compensation for psychological injuries that happen, in the workplace. I see quite a lot of that as well.
And can you talk about depression? What is depression?
Good question. We use the term very loosely. So depression is a psychiatric disorder where there is a period of sustained low mood. So basically, if people feel low one day, it's not really classified as depression. So, like, I guess feeling sad, teary, upset for most days on most days of the week. I mean, depending on which classification you use, it's for at least 2 weeks. So, I mean, there are sort of other associated signs, for example, feelings of worthlessness and guilt, poor appetite, poor sleep, poor sex drive, loss of focus, loss of concentration, low motivation.
More chronic ongoing, yeah.
Well, these are kind of the kind of the specifiers, or sort of how we judge if someone's got depression. Look, on the more serious end, loss of interest in life, suicidal ideation. These are sort of some of the things which, how we diagnose depression. Then there's sort of there's other sort of specifiers, I guess you could say, like depression with anxious features or melancholic depression or psychotic depression. There's sort of multiple different types of depression. But look, I guess to answer your question, like sustained low mood is what depression is.
And how would you deal with that? Like, what do you? Because you got the holistic approach, which I like. That's
Yeah, look, typically in psychiatry, different psychiatrists follow different sort of frameworks of treatment as such. But look, typically, I like to split my treatment into 5 methodologies. So the biological method, the psychological method, social, cultural, and lifestyle. So biological more revolves around sort of examining someone, checking if they've got sort of any physical health problems which relate to their mental health problems. For example, if someone's got a thyroid dysfunction, they may be suffering from, a depressive disorder. So, correcting that, like obviously, like we can have the option of using medication falls under biological, neurostimulation, so TMS, ECT, psychological, so like basically referring people to or delivering therapy yourself. So therapy can take the form of like cognitive behavioral therapy, like supportive psychotherapy, acceptance and commitment therapy, depending on what else is happening in the patient's life.
And that's probably, does that more sort of sit into the psychology stream, the cognitive behavioral therapy?
Yeah, look, it does. So like,
and the difference between psychiatry and psychology.
Well, see, yes. So that's sort of part of the, like psychology is the part, the broad range is one of the many treatments available we have for mental health disorders. So then social factors, relationships, housing, stable housing, like whether someone's got an income, whether they need to be connected with Centrelink, services at home, like do they belong to a religion? Is there supportive church groups, or like do they go to the mosque, or do they go to the temple? Like can we sort of mobilize troops to help these people or support these people? Do they have like a men's group? Do they have a supportive group of friends? Do they have family? Do they have like a supportive like partner or wife? Like do they have supportive kids or parents? Like these are some of the things that we kind of examine during our consultations to try and instill sort of networks around someone or treatment options to be able to find ways to help these people. So it's not just medication, it's not just psychology. Friends are a good sort of treatment, like for people. Can your friends actually listen to you if you've got a problem, right? We all know the benefits of exercise, but when you're feeling depressed, it's hard to kind of, get up and go and exercise. Will your friend come pick you up from your house? They take you for a walk.
Or give you a call like Ben does to me.
exactly.
Yeah, that's right.
He's like a little angel, this one.
Definitely is.
He is,
Yeah,
mate.
definitely is.
He's one of those.
He's a top
You are,
bloke,
mate.
yeah.
You're a cure, dude.
But I've heard that sort of saying too. Like I've heard people talk about relationships and that as well, and mental health, where longevities can relate back to that social connection and connecting with people. People
Just
in
talk.
isolation, they're not talking to people, they're not connecting.
Yes.
Yeah.
100%.
It can sort of lead to increased risk of
social,
depression, right? Yeah.
totally. Social connectedness is a predictor of longevity. Like you will live longer if you're sort of more socially connected.
Well, that's good. I live a while.
So, I mean, definitely.
Yeah.
I mean, to answer your question, look, we break up treatment into these 5 categories, or this is typically the way I like to work. We try and break up sort of treatment into these 5 categories and start sort of ticking off. Like more earlier on when someone's got a more severe illness, we kind of focus more on the medication, the biological sort of treatments, medication, TMS, like bring them into hospital if they've sort of any risks, like risks of hurting themselves or others.
So that's good.
So we kind of approach treatment that way.
Yeah, and you can give solutions too. Like,
That's right.
you know.
Yeah, that's right. That's right. So I mean, that's typically, I mean, that falls across the spectrum of mental health disorders. So
Wow, man. Like, and how many? I'm always curious of how young.
Yeah,
how
I
they've
was
been
thinking
depressed,
exactly the
dude.
same, right?
Because I find with kids, I got children and teenagers now, basically start. And
I couldn't have told you. Look, you look way too young to have teenagers.
I know, I keep young. This is it. I keep young. I try, young at heart, mate. But yeah, I still got to realise that I'm that old. But yeah, the technology, mobile phones, swiping around, all that sort of stuff. Does that to me could cause a lot of depression for young kids because it's sort of they've been trained in a way of, instead of going out and in the sun or making toys, they're also creative as a kid. So what age? What's the age group? How low? Like, what do you deal with for depression?
Look, so typically, most of my patients are, if they are young enough to be at school, they're either in year 11 or 12. So I don't see sort of the very young sort of children. But I mean, I guess when I as part of our training, we have to see, we have to do a child and adolescent term. But look, it is very difficult. I mean, there's, certainly things are very different to when I was a teenager and had, didn't have mobile phones. There was no such thing as social media. Look, our life was relatively simpler. Like, we went to school, we did our homework, we played sport, we played with our friends, we rode our bikes. And we would go to a birthday party and, be home before it's dark. I don't think that happens to the same degree anymore. But look, certainly there are different expectations there's different precedents being set for children these days. Like, there's different ideals, there's different role models, there's different values. There's sort of the connectedness to the family, whilst it seems a priority with a lot of families, it's also not in a lot of families as well. So look, things are, social media has certainly, and mobile phones and like electronic devices in general has changed the way that kids grow up, and probably changed, part of the developmental sort of pathway that gets taken with children from when we went to high school than what it is today.
Yeah, they're sort of flicking around, aren't they?
They're exposed to a lot more, aren't they? The things
definitely
that they're exposed to, like on phones and on tablets.
Definitely.
It's got to have an effect, doesn't it?
It does,
as well?
mate.
Yeah.
Keeps you busy, But like, you've sort of, I guess, in your industry, it would have kicked off, especially after COVID,
Look, I guess, I was still a trainee psychiatrist during COVID, and finished my training 2 years ago. And look, I haven't kind of known it any other way.
Yep.
Certainly, the demand to see a psychiatrist is very high. A lot of my patients, but I mean, a lot of patients in general, not just mine, it's across the board, wait months and months to get an appointment, to get treated. And if there's something more urgent, then they go to the public hospital setting, they go to the emergency department. But look, as I'm sure you've all read, there's chaos in the New South Wales health system with psychiatrists at the moment. So, look, essentially, unfortunately, access has been a big problem, and there are sort of certain, measures being put in place at the moment. But look, I mean, by and large, I mean, the outlook is quite grim for access in New South Wales at the moment, which is quite sad, because a lot of people, despite having the money to pay, are not able to get the treatment they need.
What's your thoughts around like trying to help access or better improved access for psychiatry and stuff within the system at the moment?
Look, it's a really good question. Look, I guess I don't want to get into a political debate about
But
about
is it more training? Is it more sort of maybe another layer down that needs to be more qualified technicians need to be trained?
It's a very good question, but I think, look, the current pay dispute, with the psychiatrists in the public sector is sort of one way to improve, access. So, I mean, I think there's, haven't worked in the public sector for, the last 18 months, but like, I certainly think that, that the resolution of that will create more access. Look, there is, currently, measures taken by the Royal College of Psychiatrists to kind of get more trainees through. The exams are very difficult to pass. And look, not everyone passes first go. Not everyone's able to pass. Or one of my colleagues last year told me, is like a close friend of mine who's also a colleague, told me a statistic last year that only 14% of trainees finish in 5 years. Their training in 5 years. Look, I finished in 5 years and 2 months, so I was actually quite blessed to actually finish relatively on time. Look, basically, the exams are very, very difficult. So I think, and then look, obviously, there's complexity when, people are married and have kids and going through their training. It's probably was slightly easier for me because my wife's very supportive and manages the house and the kids and stuff like that. But there's a lot of women who are mothers and
working,
feed like nursing small children. So
the family household, like I was thinking, trying to fix the problem now, but to how do we avoid this happening for the younger generation? We've got to educate the parents, maybe. This is what I find, before it gets to you, because I think we've gotten a bit soft in ways of dropping the ball. Faith, technology's taken over.
So I mean that is certainly an element of mental health problems. So like I think you're referring more to psychological distress, right? So basically, there are people who have like biological conditions, and by that I mean doesn't depend on psychological resilience alone. So there's people with schizophrenia, there's people with bipolar disorder, there's people with ADHD, there's people with a number of different sort of mental health problems which are less dependent on, I guess, social factors, right? So they definitely need sort of, but like someone who's got, very bad schizophrenia or schizophrenia who's been in hospital multiple is going to have to see psychiatrist, and they most likely will need to be on medication for a long period of time, and will need multiple different supports in community. I think, Daniel, what you're referring to is like, if a child or if a teenager is sort of been through a lot of trauma, like, for whatever reason, they're going to grow up with these psychological vulnerabilities. I think that's what more you're referring to. And how do we protect that? Look, yes, I totally agree. Look, the family is a strong source of, fixing that. Like, as you mentioned, faith. But there's also a number of other different ways that like people can sort of, protect their kids or protect their families, against that. Like, team, like sport in general, like school plays a big role in that. But also raising like emotionally resilient kids, which, there are a number of really good programs and a lot of good, groups that sort of able to do that. Not just sort of within the religious space, like, church groups, mosque groups, temple groups, or But there's also sort of a number of other ways in which sort of people can learn to develop like emotionally resilient kids. But it is a skill.
Yeah, and it's hard work to actually work on yourself too.
100%.
So you don't pass on to the kids. That's what I'm big for, you know.
Yeah.
So I find if you don't work on yourself, you pass it on, and it becomes a generational trauma. And then we're coming to a point where it's just so boom out of the you know. It's and then it shows up in the workforce too now.
Yeah, look, 100%.
You know? And you got school goes through a lot now. There's a lot of kids get passes to leave their classes, you know, and then that sort of goes on like how, you know, then. Like what's next, basically, you know. So, yeah, it's a tough one. Yeah?
Look, look, you've raised a number of interesting points there. Look, I don't know. Certainly, when I went to school, look, ADHD was not super common. Like autism wasn't super common. Yeah, like those people had behavioural problems and challenges.
I think we all have behavioural problems.
I think we spoke when you said autism, remember?
So, look, but I mean, I think there was less people seeing therapists. There was less people seeing psychologists. Like things were sort of appeared to be a bit more black and white. But I mean, was that the right approach? Look, I don't know.
Smack.
Yeah, I don't.
I used to get the cane at school.
That's it. You know? Even at home,
not anymore.
Well, no, not anymore. Not allowed.
So,
that's right.
Yeah, look, physical punishment got taken away. Look, I think there's sort of a number of sort of evolutionary measures that have taken place. Were any better or worse? Look, I think they've been guided by evidence that has been, you know, the literature that has been introduced has kind of appears to have guided a lot of these changes. I don't know whether they'd be better or worse.
Yeah, I know for me, getting the cane at school, that changed my behaviour.
It did. You were a few years. I think I came after the cane.
That's right.
Yeah, I had the brothers. They wanted to smack. I could tell there's a few of them.
Yeah,
You know? It's changed a lot.
That's right.
These are like even ADHD. That's another big thing. Like I was saying before,
completely.
adults getting diagnosed, you're saying, even 60s, 70s. Like, how does that?
Yeah.
How do you? Because I get told I might have it, but I don't know. I can control. I can direct. I guess I don't know. Like maybe I should come see you, to be honest. But
I think I need to see myself to tell you the truth. But look, I think you know, there is obviously a large push on social media for ADHD. A lot of my patients come in and tell me, look, I watched this TikTok video, or I saw this on Instagram, or like, you know, my child got diagnosed with ADHD. I think I might have it as well. Look, there's obviously a lot more awareness. The difficulty with ADHD is there's no blood test, there's no MRI or CT scan. You can do the assessments are very subjective. I mean, you could give the same patient to two psychiatrists and they could come up with two separate formulations, two differing formulations. I mean, by formulations, I mean like a summary of their findings. So you know, unfortunately, with ADHD, there's very little sort of you know, tests we do clinically to prove someone has ADHD or not. And when you look at, you know, some of the questionnaires that we give ADHD are highly suggestive. Like, for example, do you do things without fully listening to or reading instructions? I don't know anyone who's answered yes to that question. Like, so, like they're highly suggestive. So look, I'm not, and look, I think ADHD, or like there's sort of, as a psychiatrist, you have a clue, like you have sort of a strong inclination as to whether someone has ADHD. So like, I was actually having this discussion with my colleague just yesterday. So out of all my patients that come in for ADHD diagnoses, a third of them have childhood diagnosis or have come from another psychiatrist. So that's relatively easy. They kind of got an established diagnosis. You know, the second sort of third of people have ADHD. Like you kind of, you know, I'm relatively convinced that they have ADHD, you know, and start them on treatment. The final third, I think, have another mental health problem, which may be confused with ADHD. For example, one of the cardinal signs of depression is loss of focus and concentration. If someone's depressed, they could actually think that they have ADHD because they can't concentrate or they can't focus very well. So by treating their depression, their concentration improves, and then they're not sort of as convinced they got ADHD as well. Or there's a number of sort of medical conditions which mimic ADHD, for example, like iron deficiency, sleep apnea. There's a wide range like neurofibromatosis, thyroid problems. There's a number of different things which can mimic ADHD. So really taking a good history, checking,
complex.
checking people's bloods to make sure they don't have a medical problem which is kind of presenting it like ADHD but isn't, then treating that or referring to the appropriate specialist to treat it is kind of really good because I mean ultimately you don't want to be putting someone on a stimulant medication for the rest of their life if they don't have ADHD.
That'd be hard to come off if they. Do people ever come off the tab?
Look, they do actually. There's quite a few, and I try and there's a number of different. So there's not just one treatment for ADHD. There's a number of non-medication treatments for ADHD. There's psychological treatments. There's this is coming in from America quite heavily at the moment. There's managing ADHD through nutrition, through sleep, through cognitive behavioral therapy, through supplements, through nutraceuticals, exercise. So look, there are patients who come in for a diagnosis and say, look, doctor, I wanted a diagnosis, but I don't want to take stimulants. Or stimulants are contraindicated, like they've got a heart problem, or they're stimulants cause people to lose weight, and they're tiny as it is, and they don't want to lose any more weight. So we've got the option of prescribing a non-stimulant treatment for ADHD. But look, some people say, look, I just want to manage it with psychology and cognitive behavioral therapy and anything else that you suggest. So there are sort of
and there's a massive techniques. Push now for that too. You're saying
there is. So there definitely is.
Stay away from.
They don't want to be on medication. So and I think look, after COVID, like there's different levels of trust people have with pharmaceutical companies, and like this is sort of another thing. So
and that's of course another avenue. That whole trust, people went a bit crazy.
Exactly.
The world flipped around. That's far out. Because to get diagnosed with ADHD, obviously, can you tell without going through? Can you be able to tell like the way someone is without going through the system if someone comes in?
So look, I mean, ADHD assessments are fairly comprehensive. Like I do spend a lot of time getting to that point of telling someone that they've got ADHD, because I certainly don't take the diagnosis lightly. And I don't do it over the phone. I don't do it on video conference. I do it when the person's in front of me. I mean, there's a lot of things that I need to be convinced about to be able to diagnose someone. So can I tell? I can tell with a high degree of certainty after doing an assessment. But can I tell by someone walking down the street if I don't know them? Probably not. I usually do fairly comprehensive assessments. I ask them to complete questionnaires. I speak with a relative. I look at school reports.
You go deep.
There's a lot of validation.
So there's a fair bit involved. It's not just sort of speaking to someone for 10 minutes and giving them a stimulant.
People want to get diagnosed so they get on medications. There's a lot of that too.
So and there's different ways people get diagnosed. But look, I typically try and really work out what's going on. So like typically really try and focus on the patient, like what's led them to this sort of situation at this point in their life. So if someone's been, and I guess the hallmark that I'm looking for in ADHDs, I mean, if someone was to ask me what the main reason, like, what was the main sign that, or one of the main things that people with ADHD present with, I would probably say, look, they haven't reached their potential in life, right? And I typically see that after they've got treatment. And look, a lot of my patients, I've got patients who are CEOs of, Fortune 500 companies. I've got a couple of patients who are politicians. I've got patients who are, entrepreneurs. And look, after they do get treated, their progress in life.
Yeah, it's like superpower, isn't it?
Yeah, they do. But sometimes these things are being missed as a child. And for whatever reason, their parents didn't want to get them treatment, or their parents didn't know, or they went through school. And basically they weren't able to get treated. But look, typically, there's a lot of people who, there's quite distinct clues, people weren't able to stay in school, or got expelled from school, or suspended a lot of behavioral problems, talking a lot in class, basically getting in trouble a lot. It may have been confused with misbehavior or being defiant at school. But ultimately, if people do sort of come into the right treatment, they're able to kind of, get on with their life and get treatment.
Some of them just bored, really.
Potentially, yeah.
Brain active.
Potentially,
really, Yeah, that's when they're with the workforce too. Like when you part of your program, would you have to sort of look into that?
Yeah, we have to assess people within the workplace. I guess it's hard for managers to sort of diagnose this stuff, and that's where we need sort of specialists, to do that. Yeah.
Yeah, there's a lot of government agencies have a lot of kids like that, and they can't work full time because they lose their benefits as well.
That's right. But
So
I think part of the problem that people like Ben have is essentially employers notice these conditions in their workforce, but have no avenue to get these people treated.
Yeah.
Right. Because to see a psychiatrist is very expensive, right? Not everyone can afford that. The government doesn't have any outlet for getting these people seen publicly, and there's basically a bottleneck in the system at the moment to get these people seen, assessed, diagnosed, treated, and I think that's going to flow on more and more to people like Ben. So he's going to identify this problem, recommend X, Y, Z, but the employers are going to get stuck because there's no sort of easy way, or there's no efficient and cost-effective way of getting these people treated moving forward. And I think this is going to be moving forward because, currently when you look at the solutions that employers provide, what are they? Like EAP, how much is an EAP hotline going to do?
And I guess too, managers having that awareness and training, how to assess this stuff.
It's a hassle, it's very hard. And that's why we've found to get. I've met some good young workers, but they're just companies. In reality, it's just don't need anyone, or they push it away. And you think, how do we get these people? How do we get these young kids to work?
Exactly.
So, I don't know what's going to happen, but psychedelics.
Big area.
What's going on there, mate?
Yeah, look,
it is coming.
It's already here. It's very specialized at the moment. I'm currently not doing it. But look, I think the future is bright for people who have treatment-resistant depression. So by that I mean they've been treated for depression with 2 or more antidepressants and not had a adequate response, right? The definition is being treated for by 2 or more antidepressants at adequate doses for a period of 3 weeks and not had sort of improvement. So look, I guess the gold standard for treatment of depression is typically electroconvulsive therapy, which is, I guess, the shock treatment. It's got very bad stigma. It requires an anaesthetist. You need to be in hospital. And there are some sort of contraindications. But look, things like TMS or transcranial magnetic stimulation is, honestly, I really like it. It's you can go for your treatment. You don't need an anaesthetist. You don't need to be put to sleep. You can drive home after you finish. You can go to work. There's very little side effects. The most prominent side effects are feeling a bit tired or a bit of headache. So the charm of that is there's no side effects to a medication. Now, most people on TMS are still taking an antidepressant, but actually from the TMS procedure itself. There's no sort of
So
side
what's that?
effects.
How does that work?
So it's basically what happens is there's a magnetic coil which is put over part of the brain which is called the prefrontal cortex, which is, I guess, the area of the brain responsible for depression, and magnetic impulses are kind of fed through to that prefrontal cortex, and that kind of improves the flow of energy or neurons through that area to produce a result. So, I mean, essentially, this treatment called TMS, you require about 20 sessions to start feeling some improvement, but the total course is approximately 35 sessions. Wow. That's funded by Medicare. Depending on where you go and get it done, there's sort of a small gap to pay. And then Medicare also fund a top-up treatment of another 15 sessions down the track in case you have a relapse. But look, I really, really like this therapy because there's, no side effects. You're not taking significant amounts of time off work, like whereas ECT, you pretty much have to be admitted to like a private hospital. Publicly, it's very difficult to access unless you're very, very unwell. Especially now, look, I'm not sure, but a lot of my colleagues in the public sector have told me that with the shortage of psychiatrists, they've actually closed down a lot of the ECT, or like they're not doing it sort of as readily as they were before. So TMS is, look, obviously I'm really a big advocate of it because I think, it's got, risk benefit analysis. If, in my opinion, it's a no brainer. If you've kind of tried, 2 or more antidepressants. I mean, there are things like Esketamine now. So Esketamine is a nasal spray. The PBS, or the pharmaceutical benefits scheme, like the government have kind of subsidized this. Before it was a very expensive treatment, sort of very limited people could afford it. It's now become quite affordable.
Is that just a nasal spray? Is it?
It's a nasal spray. So but it's a nasal spray. You need to get it done under supervision. So there's a nurse or a doctor who sort of monitors you. There's a few sort of contraindications and like side effects. It's not as, I think TMS has less side effects. But look, yeah, Esketamine is becoming very sought after. There's a lot of inquiries for it. But again, you need to be it needs to be prescribed by a psychiatrist. Psychiatrist needs to assess you and determine that it's appropriate for you. And it's not appropriate for everyone. It needs to be used under medical guidance and close supervision. But it's look, it's definitely, the future's looking bright for people with depression. I think there's sort of a lot more treatments available now than there were before.
Yeah, Jesus, just so much. So
there's a lot to it.
There's a lot to it, mate. Well, and like yourselves, I have days that I'm down as well. Yeah. We're all human, and it's like, I don't know, it's becoming a big thing now.
I think exercise is a big part too, right?
Well, this
that sort of keeps us
on
the level and narrow. Right?
Yeah, like you keep fit.
Yeah, I try to.
You're a machine, man.
No, he's a machine.
I like to. So I think exercise is a big part of anything,
huge.
right? Like, it has to be sort of ingrained into what you do. Right?
Yeah.
Like some days you don't feel good, you got to do it.
Yeah, I'm a big thing of that, exercise.
Yeah, totally. Like exercise is a critical, and it's, I don't know if you remember earlier on, I talked about the 5 methodology of this treatment, but one of them is lifestyle, and in lifestyle comes exercise. So look, basically when people ask me what kind of exercise I tell them, look, do whatever you can do, right? So that's the first thing. Like if you can, look, I can't do anything. Okay, can you walk for 5 minutes around the house? Oh, I think I could do that, right? And then the next appointment, okay, can you walk for 10 minutes? And like gradually, like they might be able to, get out, especially, when they're treated with medication, they might be able to manage a 30 or 40 minute walk where they're sweating, or like, some do a lot more than that. But I think the evidence that the literature points to high intensity interval training, so HIIT classes, where you're sweating, where you're moving a lot, like compound movements, they're the things that really kind of improve your mood. And look, to tell you quite frankly, like, I mean, I notice when I don't go to the gym in the morning. I know that I don't have as good a day, right? I notice that I notice when I haven't slept well. So, exercise, sleep, like diet. I mean, these are things we could do a full podcast on to tell you.
Oh, this is it. Yeah.
But then,
Yeah.
then your relationship with your spouse or is sort of, very important. Your relationship with your kids. I mean, if you don't have that connectedness, on a frequent basis, these are things how, like, I personally fill my cup with, exercise is a key one.
Self-care,
and nutrition,
right?
yeah.
It is, man.
Self-care.
That
like,
temple.
Yeah, that's right.
Yeah.
Got
Got
to
to keep
temple.
the trunk strong, mate. The
that's
branches forward.
100%.
Yeah, and it's good for everything, mind, body, soul.
Yeah, it is cold these mornings, and it's quite difficult
I'll
to
tell
get
you
out
what,
of bed. But
Under the phone like
but
sheets. I wore socks
Electric
last
blanket,
night.
eh?
Yeah, I wore socks.
Yeah.
Double shirt too. It's
so yeah, look, it's freezing. But like, I kind of think to myself, okay, like, whilst it's hard to get out of bed, I can, like, I don't want the consequence of not working out to me are even greater. So like, I can't be there for my patients, which is probably more important than thinking about myself. Early in the mornings when I don't feel like getting out of bed. So,
Yeah. That's all right. You should go for your walks,
Yeah, well, that's right. So yeah,
Swimming's good too. I say yoga and swimming are really good. Yoga's good.
I haven't done much yoga.
You should, man. You get there.
well, look, the exercise that you should do is the one that you're going to do.
Yeah, there you
so like, if you enjoy something, and that's what I tell my patients, is like, if you enjoy doing something and you're going to do it. Right? I can sit here and tell you what to do, but do what you're going to do. So yeah, that's the most important thing.
And you're a busy man. Do you get like much time with the family? You go have your holidays, your breaks?
Yeah, look, I do. So basically, I do sort of have to schedule that.
Yeah.
So look, basically, look, I'm fortunate not to have to work. Like, I don't work 5 days, so to work less than 5 days. So like, the days that I'm not working, I'm able to, pick up the kids from school. I take my kids to sport, and look, on the weekends, I work Saturdays, but looks Sundays I'm available. And we try and sort of get away most school holidays. The days I do work are long hours. Come home, sort of leave early before they wake up, and come home after they're in bed. But those days are, I'm learning, sort of adjusting to my own work-life balance, or I like to call it work-life integration, because I don't know if you can ever reach a balance, really.
No. Well, why don't you try?
So
if it falls out of place, you get too into work, and then sometimes you go a bit too.
That's right.
You lose that.
Yeah.
And you get a bit depressed. And
Yeah.
that's when
Look,
you gotta
having
take
a
break.
supportive partner is sort of is critical to sort of, like, going through training, having to study most weekends and after I get back from work was, I don't think I could have done it without my wife, like, having, two very small children. So she was there to sort of prop me up, and for most of it she was working as well. So it was actually pretty challenging, in those early years. But look, I think whilst I despised it at the time, I actually, now in hindsight, really glad I went through that, because you can kind of understand some of the struggles my patients have, like going through training.
Dude, it must humble you.
Yeah,
Some
definitely
of the
does.
patients you get back what I've got to worry about.
Yeah, 100%.
Man.
100%.
And it's a state of mind too, Like, do you send people on it? Do a lot of different spiritual people come, like faiths or anything like that as well? Like, do you sort of direct people that way as well?
Oh, totally.
Find God in a way?
I mean, look, God's been an important part of my life since I was sort of an early teenager. I do encourage people to reconnect with God if they're that way inclined. A lot of people find comfort in connecting with God, and find a community that they can actually connect to God with, because I think, look, having that support structure in whatever format that takes is really important, with the exception if people using drugs and they want to hang out with their drug taking buddies. I sort of discourage that, but I think it's very important to kind of find your community, like find your tribe, like, of people who are going to support you during difficult times. So like, finding, like, connecting with God, or sort of reconnecting with God is again part of treatment. So again, in that sort of those 5 ways, like cultural is under cultural comes religion, church groups, mosque groups, temple groups. And for some people it's like Alcoholics Anonymous. For some people it's Narcotics Anonymous. For some people it's their roommates who they live with. So finding that core group of people is really important.
It'll lift you up.
Yeah.
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 Oh, you're a faithful man too.
Yeah. I suppose, like being a Christian, like, you know, follower of Christ, like, it's trying to have that discipline to do some of the things that, you know, what Christ would do or what God would want you to do rather than what Ben wants to do, right?
Yeah.
So there's a lot of things that I want to do that's not always aligned with my faith, right? So which is I guess the sinful part of a human, isn't it? You know,
Yeah.
so we sort of want to do what the world wants to do, and sometimes it's not always in line with what God wants us to do. You know?
That's why I
Often
think.
that disconnect, right?
Yeah, that's why I think that going back to the families, I think that's what's lost a bit. I know. Yeah. I used to go to church every Sunday when I was younger, you know, and it sort of does get lost, and I find that's a big part of where even
The family unit.
it does, it's huge, you know, that faith, the husband and wife, the mum and dad, the family unit, those values, those core values,
value
they're
alignment.
lost, man. And I think God is lost a bit. And I think, again, going back to COVID, people woke up a bit, but it's hard to see people go back into that rat race, that you know, that cycle of things again, and just lost it again, you know. Everyone wants to,
Made us ask a lot of questions during COVID, didn't it? You know, had the time to think, reset.
yeah, huge. And then I've sort of lost it again. It's weird. You get close,
Yeah, you get drowned
things
in the
got
noise.
delivered nicely to me, and then it's sort of, I don't know what it was. It's like the devil's work or something.
Yeah.
I don't know what it is. You get lost again, you know, and you go to that state of mind. You know, when you think negative and everything's negative around you, you know, there's a lot of that I feel around a lot of people now.
There's a lot of pessimism and negativity in the COVID period. Like, you know, people were isolated, lonely, drinking a lot. You know,
Watching the TV, telling what to do.
yeah, watching the TV, social media, you know, probably indulging in things they shouldn't have. There's a lot of broken relationship, like a lot of people sort of ended their relationships during COVID. It was sort of a dark time for a lot of people, but it was a good time for a lot of people as well. Like a lot of people were reborn again. A lot of people realized that, you know, sometimes we don't control. Like, who would have thought that the airports would have ever been closed down? Who would have ever thought that, I don't know, a city like Las Vegas would have closed down? Like, that place is open 24 hours a day. I mean, there was just, and it didn't seem like many places or many countries were immune to sort of, you know, what was happening around the world. So, yeah, but at the same time, I mean, we've discussed, you know, there's a lot of, you know, innovation, a lot of disruption during COVID. You know, I did, being a sort of a health worker, my life didn't change that much in terms of going to work. I guess it was probably better for the family in the sense that my wife worked from home, was able to sort of look after the family a bit more. My son, because he went to a daycare for health workers, he kept on going to daycare. We didn't keep him home. And, you know, I actually think, like, you know, I wasn't able to see my extended family, but we remained connected through sort of other ways and, you know, other means. But yeah, look, COVID certainly did bring about, you know, mixed sentiment into society, but taught us that we're not invincible.
Yeah, and to be resilient. That's what I've learned a lot.
That's right.
You know, that's to be not that you can't expect anything really.
You can't.
A couple of it was 5 years ago.
I know. It's crazy, isn't it?
It's like that. Yeah.
And a lot's changed since then.
Yeah.
And that's why we're here, you know. So, okay, well, I mean, whereabouts do you work from? Where's your office?
So look, I work in 2 private hospitals. One's in Chatswood, and the other one's in Kellyville. So I sort of spend a bit of time at each of them. So I split my time between each of them. So yeah.
Oh, good.
That's kind of, yeah. So
that's it, but only a few days a week now. No,
look, I'm there sort of 3.5 days a week, but basically, I split my time between those two things, and on the other days, I kind of catch up with my, correspondence and letters back to GPs and letters to insurers and things like that.
Oh, you're bored, so you got to be educated. So you got to always stay up with.
The times. Yeah. I do my professional development as well in those days. And look, I try and read, several hours a week to remain on top of things. So it's slightly different working in the public sector where you're constantly around new things. But when you work privately, you're slightly isolated, and you sort of have to make a bit more of an effort to sort of read, find out the trends, go to conferences, watch webinars, listen to podcasts, talk to drug reps when they come and see you, to find out what's happening. So there's different ways in which I kind of get my education. Like I do, so I'm part of 3 what we call as peer review groups. So basically, some are in person, some are online, but we kind of discuss cases which are complex that sort of people want some guidance on. So I get my education through sort of these ways as well. But look, I mean, obviously, I've done a lot of study in my life, and I enjoy learning. Just a bit. So look, obviously, I enjoy learning, challenging myself. So I'm happy to sort of I enjoy sort of learning. Yeah,
it's great.
So,
you of the workforce always be educated too.
Yeah, it's what in terms of
learning the laws coming in as well. It's always changing.
Well, we've got ChatGPT now for that.
Oh, that's right.
But that's the new wave, right? It is in terms of disruptive, the way we learn. AI. There's a lot of it's continual learning and professional development, improvement, isn't it?
Yeah, and like you said, AI too. Like that. That's
it's very disruptive, right?
Oh.
So
are we going to get to a stage where no one's going to think?
It's more like around how do we prompt AI to give us the right answers for certain things, right?
We're going to use it so much. It's going to use us. Take a bit of control.
It's
Well,
it's scary. It's scary.
It is scary, mate. It is scary. But no, this is
the avatars.
Yeah, we are. Yeah. We are. This is why we're going to bring back the faith, mate.
Yeah.
I think that's the solution.
That's right.
Start from there. Oh, thanks for coming out.
Pleasure.
Really,
it's a pleasure.
Thank you for giving up your time, and
it's a pleasure.
I hope to try have you back one day. Get an update, maybe.
For sure. Can definitely
get an update, see what's going on, because I'm still going to keep searching.
It's a good way to do it, though. Keep searching. There's not one answer fits everyone.
No.
Especially when it comes to, distress, relieving distress. But look, developing that emotional resilience, or sort of taking control of your thoughts, and the way you're able to kind of guide your thoughts is very important. So I've taken the liberty to look behind you at your bookshelf, and I mean,
these are Nick's books.
I saw Simon Sinek.
You can
start with
why,
why,
I mean,
right?
I've actually I've read a lot of these books actually.
Twice.
And, look, a lot of these books, especially around, Tony Robbins, Eckhart Tolle, The Power of Now. They're brilliant books. I mean, these people, these authors, really encourage mental resilience and teach you how to, the power of a directed mind, which is something I think we take for granted. And certainly, I think, and a lot of the books up there, to do with wealth creation and habits. I honestly,
Green's good.
I do believe a lot of these philosophies come from, whether it be, real estate or, shares or dealing with people or, building rapport with people. Like a lot of these things start with, the power of a directed mind and sort of taking that first step in grooming your mind to do what you want it to do. And yeah, we can sit here and talk about ADHD and medications and things like that. But look, ultimately, that's something that I think we all struggle with at different points in time, like directing our mind to do what it needs to do, like negative thoughts, negative thinking patterns, negative self-talk. These things affect all of us. It's just the degree to which, we can control them, really, and not necessarily believing our thoughts, which are not necessarily like our thoughts aren't us. Our thoughts are our thoughts. I guess this is probably part of a wider discussion about how we do manage our thoughts.
It makes us, right? The mind makes makes who we are, isn't it? That's the manifestation that they talk about.
100%.
So that's where you can have a whole couple of hours to discuss that. The next time.
And I know you've got The Secret up there, which is sort of what prompted me to the book called The Secret, which is what prompted me to kind of talk about that as well. Great book.
Do you like Robert Greene, right?
Look, there's not many books up there which I don't like, Daniel. There's I've read most of them, like Atomic Habits, Mark Burris. I remember we saw Mark Burris speak a couple of years ago. Look, I'm a big fan of Tony Robbins, The Power of Now, Simon Sinek. Look, there's How to Win Friends and Influence People. It's like one of the most classic. Man's Search for Meaning. Well, Man's Search for Meaning. That was basically a psychiatrist in the camps when Hitler was basically doing what he was doing. So actually the author of that is a psychiatrist. So I read that book very early on in my training. Victor Frankl, his name was. So it's a great book and really teaches us the power of our thoughts. So have you read the book?
No, I haven't.
So
I'm going to read it now.
So the book is about so Victor Frankl. He was a psychiatrist. He was a Jewish psychiatrist in the time when Hitler was persecuting Jews, and he basically had his son with him. And every time something bad happened, he would basically frame it to himself that it was a positive thing, and tried to really not get carried away with all the negativity and just sort of kept instilling positive thoughts, even though he knew there was a very minimal chance he would get out of this camp. But ultimately he did because of the power of his thoughts, which is why the book, I mean, when you look at the title, Man's Search for Meaning, like it's the meaning that we give things in our lives that kind of ultimately dictates what we believe and how we act and behave towards certain things, and 100%. So we can interpret things we can give things an empowering meaning, right? Or we can give things a disempowering meaning.
That's right.
Now, particularly my patients are sort of stuck in, my boyfriend left me, it's the end of the world. How did he, what did he do? Oh, he cheated on me. Oh, he kind of takes drugs, or he hit me or whatever. I mean, I kind of try and reframe that and say, okay, why is this a good thing that he left you? Oh, look, if he cheated on me once, he's going to do it again. If he takes drugs, our kids, and we got married and had kids, our kids might take drugs, and trying to, slowly reframe that. Okay, the meaning that you've attached to the event in your life has actually been probably not a great meaning, or it's not one that is certainly going to empower you, right? So look, gradually getting people to shift the meaning they give things empowers them, right? So this is, obviously relationship breakdowns are a big one, and I think, a lot of, depression or depressive symptoms are caused by relationship breakdowns, and trying to get people to understand, okay, is it that bad? I know it's a horrible event that has happened to you.
Yeah, the way in which we look at it from a different perspective, right?
It's, I really feel for you that has happened. I mean, like, basically having a relationship breakdown is not fun for anyone, but
it could turn into a blessing, maybe.
Exactly. Like, what meaning are you going to give to this, right? Are you going to be like sulking and thinking about all of the bad things, or are you going to give it a more empowering meaning so you can pull up your socks and go and achieve things one day? So, I mean, these things here are probably things less. I don't get as much time to address with my patients, but I think these things are sort of very important to develop mental resilience, which I think, we were talking about earlier.
Yeah, well,
what do you do with your kids, or how do you teach your kids? Like, if you're able to attach a better meaning to a negative life event, then you'll probably get a better outcome.
Yeah, it's like I always go back to the Stoic way. Obstacles the way.
Yeah,
like whatever faith. I like to listen to that. It gets me past. It's
That's
like
right.
Alan Watts. I think we discussed Alan Watts. Just to move on, let it go, let it go, let it go.
Yeah,
and once that, it's like
keep moving.
Yeah, the sail. You put your sail up in the ship, and you go with the wind. You don't go against it.
That's right.
You
Exactly.
just go along with it. Be resilient. All that saying. It's the same thing. Because you do get in those holes. I still fall into the trap sometimes.
Yeah. Well, don't we all?
I know. It really does, and and this is why you have your friends and your people around you to discuss it,
100%.
mate.
And also sport and exercise too, right?
Oh, dude.
You learn a lot off the athletes too in terms of their mindsets, and positive thinking, and
team sports is very
that's
important.
right.
I think for kids as well.
Yeah.
Sports is a huge thing, man. That's why I always support sports for kids, mate. And I think that's where the mindset as well, like you said, and it gets you out of that dark hole thinking. You move on before you even realise I was sulking about that. But now focused on lifting this weight or beating this team or on a move that you're working on.
Yeah.
For sure. Nick had a fight. Won his first amateur fight, so I had to bring him into it. I was very proud of him.
Amazing.
He was a machine, wasn't he?
And that's where I think boxing's really good. And I say boxing because it's a lonely sport, right? You and that other guy in that ring in the 4x4, and it's either you or him, right? So, and if you don't train, you're going to get found out.
Yeah.
You're going to be fatigued and found out.
Yeah.
And then the other F word, which right?
And you do, because everyone thinks, I'll take you on.
Yeah,
I can do it. Yeah, I'll start. Nick can train me. Right? He's got his next one. We've got to go.
Yeah.
Yeah, you can come too.
Feel blessed.
So educating the brain, educating the mind, reading, feeding that. Knowledge is power, as they say, and that's another thing why I don't know if kids are reading these days too. So I still push through for that.
Yeah, for sure.
So no, that's good, mate. Anything, Ben?
No, I think some of the discussion's been great. Thanks to Hussein. Yeah.
No, pleasure.
Shedding some light on your journey, mate.
Pleasure.
I know so it's been a long road, hasn't it, in terms of your studies and to where you've come, mate. I'm quite proud of this, man.
He is proud.
Thank you. To have a friend that's gone through psychiatry, and then some of those times when Hussein mentioned those examples where only a certain amount of people get through some of those exams. I remember you telling me, like,
look, Ben's obviously been, look, he's obviously been a great support from me for, well before I started my journey. Look, equivalent to, my wife and my family. Ben's been there for me. So look, it's always a privilege to speak with this guy and get his support as well. So it's kind of a journey we've been through all of us together. So
brothers, mate, the trenches.
Yeah.
No, it's good. Thank you so much, Ben. Thanks for referring me. Bringing me here, and we'll catch up again soon.
Sounds good. Thanks for having me.
All right.
Thank you.